Welcome. Welcome to another episode of our podcast, Impact of AI, sponsored by AI Time Journal and supported by WILDA, Women Leaders of Data and Artificial Intelligence. Every week, we explore how AI and cognitive technologies impact us both daily, professionally, and personally. Today, we are fortunate to have Dr. Sue Tripathi with us today. Now, she's a managing director for data and analytics and global services at NTT Data, which is a global consulting firm. And she focuses in healthcare and life sciences and brings today 27 years of industry thought leader as an international speaker. Now, what's very interesting about Dr. Sue Tripathi is that she's a recipient of several fellowships that I'd like to highlight: the National Science Foundation, the National Geographic Society, the National Academy of Science, and the International AIDS Society. And in addition to that, Sue is also responsible as a principal investigator for various grants, including the MacArthur Grant, the RWJ, and Mott grants. Welcome, Sue.
Thank you.
So in looking at LinkedIn, because if you've listened to this podcast before, you know that I stalk you on LinkedIn before you jump on the call. And what was interesting about your journey and your career path is that you did get your doctorate, so congratulations, in healthcare and statistics. And as you've gone through your journey, where you are today is a managing director of data and analytics. So I'd like to understand where you started your journey in your career and how that's taken you to where you are today.
Yeah, well, thank you, Melissa. I'm excited to be here. Thank you so much for this opportunity. And yeah, do please call me Sue. The moment I get called back to Sue, I feel like I'm in trouble. So,
got it.
So let me begin a little of, my journey and how I am, got to be where I am today. So early on when I was in college, one of the key things that I was always attracted to was around numbers, but never around math, more around statistics. And I come from a family where I have mathematicians in my family, including my mom and my brother. And so that was, I think, innate. It was there, but it was never called. And I think during my college years, I decided that statistics was something that I liked. I understood that much more, frankly, than I understood math. And that spoke to me because that was, quote unquote, more real world. Mm-hmm. And so my master's degree actually is not related to statistics at all, but my doctoral degree is. And in my master's degree, I did a lot of work more around urban planning, geography. Statistics was part of it, but it wasn't the focus, economics, etc. And as I did that, one of the things that dawned on me is that there was data constantly around us. And that data was part of information. Our conversation could actually be quantified as well as qualified. And as I learned those techniques, both in graduate school during my master's as well as during my doctoral degree, I understood both the qualitative and the quantitative side of it. Mm-hmm. And I think that is where the real interest, and not just interest, but the actual formal learning of the different methodologies and the techniques came into play. So a good example is where on the statistics side, where I took a basic, intermediate, and advanced statistical courses, thanks to the chair of my department, I learned not only about regression and cluster analysis and multivariate analysis. What I was challenged, frankly, to do was to learn far beyond what was there in the books. And so I owe a lot of my thanks actually partially, not just to my parents, but also to my advisors, my whole committee, my PhD committee, and of course to my advisor, to the chair of my department as well. And what they encouraged me to do, especially this one particular professor, is to think out of the box. And I got exposed to something called Q analysis, which I applied in my doctoral work, which was on HIV and AIDS. And when you are asked to actually get out of your comfort zone, what you end up doing is you end up researching a lot yourself. You end up talking to people that you never thought that you would talk to. And there were only 3 or 4 people that I actually was able to connect with who had done this kind of analysis, which was around Q analysis.
Mm-hmm.
And so Q analysis was based on set theory, and set theory is basically more in the pure math field. But long story short is once you get out of that comfort zone and you start going, looking at, you know, ways in which data could be applied in the real world, which is what I was doing, working on HIV and AIDS, working internationally. I went to work in India. And that too was encouraged by these groups, this committee, by the group of people. I was very keen actually to work in Ohio, which is where I was getting my degree from, and none of them wanted that. They all said, we've done some work in the US, we wanted you to go abroad, go wherever, go somewhere in Africa, go to India, go wherever it is, but not in the US. And so they encouraged me also to learn how to write proposals. That really was also another thing that I'd never done before. So I think it's a combination of many things in this journey of where I went from going to college, figuring out stuff like most college kids do, to then honing in on areas that I didn't think I'd be good at, and actually it turned out to be that I was good at those, and areas in which I thought I was good at and probably wasn't so good at. So part of going to graduate school is actually also figuring some of that stuff out, looking at your peer group as well as your the researchers and your professors, and the constant encouragement and support that I always received from my family. And I think I was very lucky in that, because one was that innate thirst to learn. The second one was to getting out of your comfort zone. The third, of course, is to get your formal education in the way you get your formal education, and then the application of it. And then understanding that there are really two sets of data here at a very minimal. One is your quantitative data, for which I was getting formally educated in. And the other one was the qualitative data, in which, you know, we learned about participatory methods, focus groups, things like that, that to a large chunk of society, that was just a conversation, but actually there's a method, there's a technique that you formally learn, right? And even that you can quantify some of that. And then bringing those two together from my dissertation work and then presenting that. And as a result of that presentation, I was able to actually write a number of grants, write a number of articles in refereed journals, write some chapters in edited books. I was able to do a lot. And so the fruition of that work is not just that you submitted your dissertation, but frankly, the application of your learning, what you learned, the knowledge, and then disseminating that knowledge, and then continuously improving and continuously learning. That is very much part of, I think, this journey. And that helped me to move, frankly, communicate from one organization to the other, whether it was in the public sector, whether it was in the private sector, where I largely have been working in health and human services, but then honing it to a point where I started to lead data groups. I was asked to come in and help 17 divisions in child welfare, for example, to help them quantify something that they had historically done paper and pencil, and there's lots of data. None of it was on the computer. None of it was stored, or even, frankly, there was no schema to it. So, you know, basic evaluation methods or program evaluation methods, basic data methods. So beginning from scratch and showing people, not just saying, here, let me create those databases for you. Of course, I'm dating myself a little bit. So this is way before we talked about data hubs and data lakes and AI and ML, right? This predates that. And just showing them the utility of what data can do for them, instead of saying, we want to get to a data-driven culture. How do you get to a data-driven culture? What does that mean to you? What insights can you glean from the data that's presented to you? What can you do with descriptive or even predictive analytics, right? And in those days, we used to use SPSS or SAS or whatever else, right? Whatever software was out there. Now it's much more speedier. The adoption is much faster. You know, we have grown incrementally in this field, in the field of data science, AI, and ML. But from that's where the roots were, the application was, and then learning along the way. And frankly, being a little ahead of the game in the sense of going and researching yourself. but none of it is something that I can say, I just did it myself. It was frankly based on the encouragement of the people that I work with, either in the workplace, my supervisors, people who are peers to me, people who reported to me. I mean, so along this journey, it's frankly, how open and receptive are you going to be to understand the value of what you bring to the work, the value of data, the insights that you want to glean from that data, and understanding that there are, at least at a minimal in the workplace, there are two customers, your internal customers and then your external clients, right?
Yeah.
You understand those two basics, then it frankly doesn't matter what AI/ML model you're building, because you understand the foundational pieces and bringing people along. So today we talked about data literacy, data maturity model, data assessments, data strategy, data governance, data management, and we have a whole group of data scientists who help us do all of that. But all of that is null and void if you are not able to bring the people internally as well as externally with you in that journey. So that's very, very important to me. And that has been my journey. And I want to continue with that journey. I'll say one last thing, which is around change management. At the end of the day, I think it is not just about data. It is not just about AI/ML. It is about the people. Your tools, your technology, data, these are very critical aspects of it, but the end users and consumers of it are people. So unless you understand the change that you're trying to help them get to, whether it's a decision for today, whether it's a revenue impact, whatever it is, that unless and until you bring them along and show them why this is of value and how you want to define success, or how they want to define success and metricize it, you're kind of not on the same plane. You're not aligned. So you must understand, sometimes take 2 steps back to figure out, what does data mean to them? Begin with the very basics, and then talk about AI/ML. I mean, then make it more sophisticated depending on where they are in that data maturity model.
I was thinking back, because you talked a little bit about statistics, and I was thinking about my first interaction and my first aha moment around, wow, I really love data, was in my bachelor's degree for management and information systems. And it was mandatory that I had to take this statistics class. I didn't like statistics at all until we got to the final. And at the time that he gave us the final, he's like, I'm going to do something completely different than what we've done the entire class. I'm thinking, great. He says, I'm going to give you a lot of data, and I want you to use the statistical methods that you've learned. And I want you to answer the question, is global warming for real? And suddenly, oh my God, it was like this light bulb went off. Like, oh my gosh, I could actually answer questions and solve problems if I have the data. And it was actually that class, and at that final, I have no idea how I did on the class. And to this date, I have yet to remember what my answer was to the question in the final. But it was that class that really decided I love data. I love solving problems. I can use data to solve problems. I need to explore this further, which is then what I went on to get my master's degree in, specializing in data. So I just wanted to, I think it's an interesting story, because it started out with statistics, and you had this combination of statistics. And I also was working around the same time you were at your Adams County government, is around the time that I was just now focusing on the statistical, class. So it's interesting that it started out that early, and then it took a long time, I think, for the industry to really come around and recognize the importance of data. And that's, I think, what you've highlighted toward the end of your career journey. Yeah.
You're right. Yeah. Right. I think that's a good summary of it, because we never talked about data science in the way we do today. There was no conversation, if I recall correctly, around data fabric and data mesh. These are relatively newer in the industry, right? And for those of us who've been using data, whether it's from an evaluation lens, whether it's from a qualitative or a statistical lens, whether it's from a financial lens. I used to work for the state of Colorado, and I learned how to write fiscal notes. And my first reaction I remember was, but I'm not an accountant. I don't know anything about this. But you learn, right? The workplace, frankly, is a fantastic lab or a fantastic experience for you to learn. Now, there could be some opportunities that may not be presented to you. This is why we have the internet, et cetera, and you can go learn and you can read. And I'm a voracious reader as well. So the other part of it is you mentioned MIS, you mentioned management information system. I took some of those classes. I took some programming classes, and that's when I knew what I was good at and what I wasn't good at. So the other part of it is knowing who you are as a person. I'm innately analytical by nature. I will analyze. I will be at the airport and I will analyze. I'm also a lean black belt person, so I will look at workflow. I will say, well, that could be automated and we could reduce our time. This is all going on mentally in my mind, right? I'm not saying things out loud. So you also have to be in alignment, frankly, I think, as I'm getting, more and more comfortable, I guess, in my own skin, to say, what is my comfort zone where I know that not only will I do well, but I'll thrive. This is my passion. This is really what I want to do.
Right.
That takes time. It doesn't happen overnight. So unless you go and try something, it's like sports. Unless you try 5 or 6 different things, or music, or whatever it may be, painting, or unless you try it, how would you know that what you're passionate about is truly what you want to pursue versus, you want to pursue it because you now know that there's specific skills that you have and that you can hone in on. There's no end to actually going and getting another degree or getting another certificate in something or the other. In fact, today's current marketplace demands that. It doesn't matter how long you've been around, right? So it demands that you are always at the same pace, if not, 2 or 3 steps further in terms of honing your skills. And there's so many courses and classes one could take without breaking one's bank. So I think it also depends, again, that's why I go back to the people, the change management side. How open are you to the change that's being presented to you? And what skill sets will you have or do you need to have, whether formal or informal, and go figure it out. And that's why I go back to knowing yourself, who you are. I am analytical. I'm also not shy. So what I don't know, I'm not going to feel shy and say, you know what, I don't know, so I'm going to be quiet. I will ask that question. And I think this is something that not everybody is comfortable with. In the workplace, especially, a lot of people are not comfortable in owning and saying, but I don't know that. I think you do yourself a big service when you say you don't know, because there are 5 people who are going to share with you their knowledge and bring you up to speed. And so you benefit a lot, actually, by just opening yourself up a little bit by saying, I don't know, can you please help? And there are so many people around you who would be willing to help, who would be willing to share, and then you can go yourself and learn yourself. So I think there are plenty of avenues in terms of learning, applying, and then gaining, as well as contributing, as well as sharing.
I want to pivot the conversation to segue into a topic that I think you're really passionate about based on our earlier conversations, which is around the health equity and analytics and really the underlying diversity in the people that helps bring about better equity.
So I think there are a couple of things that I would say in there. So I think some years ago, when maybe this was 20 years ago now that I think about it, some of our colleagues here in Colorado, I live in Colorado, I was the president of the Colorado Minority Forum, and we had applied to the Office of Minority Health. And what we were seeing was a lot of disparities in health along different racial groups. And I had done some work before that on some projects with the governor's office in Colorado on HIV and AIDS with the planning group. We had done some needs assessment just in the state of Colorado. So data, again, lots of data around you. It's the application of the data in your programs, in creating the interventions, in maybe education, learning systems, so many different ways of doing it, clinical and non-clinical in nature.
Mm-hmm.
So with this one, we saw a lot of health inequity. And part of what we have been focusing on as a nation is we've been focusing a lot on the disparities using the clinical data to tell us how our diabetic population is doing and where we see disparities, say, among the African American male or women or Hispanic or Asian or whatever, right? And we look at it, maybe sometimes we itemize it and we look at it from one lens. I could be a physician, focused on chronic care conditions. I'm going to look at diabetes and asthma and whatever else, right? Heart failure, or some of the high cost ones like your cancer patients. But the reality is we're still talking about one person, a member, one patient. And so what we have created is, in the way we have learned, we sometimes have to unlearn some of those things.
Mm-hmm.
So while data is important, the clinical data, what I thought in those days that we need to unlearn was, it would not matter, frankly, if I put in 3 more clinics right next to someone's house and say, well, now you have a clinic and you have access to services. It was all the other underlying conditions that prevented an individual or a member or a patient from accessing those services. It could be transportation, it could be shelter, it could be nutrition, housing, it could be a whole host of non-clinical, what we call today the social determinants of health, right? And so this is where the inequity piece comes in. This is not about disparity. This is about inequities in the systems that we have unknowingly created. And then how do we then come to a place and not assume that just because we have provided access to certain types of services to people, and that those services are good quality care, that someone would actually access those services. Well, that someone happens to have other more pressing issues, right, that they need to take care of before they even talk about their own health. Or, so it depends. So this is why health equity, which now under this administration has gained a lot of momentum. Till recently, each state would get about between $100,000 to $200,000, as far as I know, from the government to work on health equity, not just health disparity, health equity. Now I think it's 1 million per state and even more so. Social determinants of health is very much part in the health system around not just health equity, but actually your value-based care. Value-based care is essentially what value do you derive for a member by maintaining and preventing, frankly, your readmissions. That's just one data point. There are many other quality measures, the HEDIS measures, et cetera. I'm not going to go into that. But the whole point being is, how do you integrate care where you're looking as a member as a whole, the person as a whole? And the person as a whole could have mental and physical health issues, or behavioral health and physical health issues. And therefore, it's not just about intervention, but using predictive analytics, using your AI ML models. This is why AI ML really comes into play, to then have predictors to say, here is your entire population that you're trying to manage. And based on your entire population, here are some key predictors by which you need to prevent and provide certain types of services so that you don't have readmissions that typically cost a health system or cost in the entire society. It's at pretty high cost, right? So if you're trying to do prevention, not just intervention, if you're trying to embed value-based care, if you're trying to look at clinical quality, your financial models, bringing that all together is very important. This is where data analytics could actually be of immense use and is of immense use as of today. So I think I don't know whether this helps any around health equity. You then could be addressing your health equity issues, because using, again, some of those predictors, knowing who your population is and how you want to manage your population, you already know where those health inequities are, because now you've also got your social determinants of health data embedded. You can change your entire risk model, frankly, based not only on clinical risk, which is how typically we have historically based our risk models on. You have to factor in these non-clinical factors, but they are equally at risk. And now you have a new model that takes both your clinical and non-clinical data and creates a new risk model that says this truly is a population that you are trying to manage. And then how you will go about managing it, what prevention intervention factors you want to have in place, whether it's virtual, whether it's in person, etc. That's for the system and whatever organization that you are part of for them to decide. But at least you have embedded not only using data, but you are constantly helping the system in managing in your own way through data analytics models, managing their population and teaching them how to manage the population by looking at what types of data sets they should be looking at, right? So again, to me, for a data scientist, for a data leader, anyone in the field of data, anyone in the field of AI, ML, the applications are immense. The solutions are many. The challenges are also many. The question is, what is it and where can you actually show the value of the data, the right quote unquote data that they should be looking at, because that again is a challenge. The quality of the data, sometimes we know, you and I and anyone else in this field knows that sometimes the quality of data is questionable. I think, and then the other part of it, and this is where I begin always, or invariably with many folks, is if I give you this data and I apply this model and I give you a model and I give you a predictive analytical model, what are you going to do with it? And if you are not clear as a leader, as a, whatever your role is, as the chief, C-level, whatever you are, and you cannot define your success and you don't know how that data is going to help you, then we need to go back to the drawing board before I even start doing any kind of predictive modeling, because I need to know how that data is going to be used, because I could be churning out all kinds of models day in and day out, but that is not going to be of use because you don't know how that data is really going to help you drive decisions. And this is a fundamental issue, frankly, in many different organizations, small, medium, or large. It is not just the use of AI ML. It is what do I do with the data? How do I interpret the data? And how do I make that data of value and that's operationable today that will help me drive my decisions today, right? So the question is, how are you using data today to drive decisions? And then maybe map that out and then create a journey map of how they can use a data journey map.
There's a lot there to unpack, but I want to focus on one particular area. You talk about the equity, of the health. So I assume that we're thinking about a value-based outcomes for patients, recognizing that it's not just the diagnosis and the treatment, but there's all these other areas that could come into play for that better healthcare experience. But if I'm looking at a typical data science team or a typical analytics or ML team, how do I ensure that the diversity of that team, ensure that the diversity of the data, that I'm not going to have individuals inadvertently have either algorithm bias or maybe social bias in the way that they're assuming some of that data? Because I absolutely love what you're saying, and I look forward to when that becomes the norm and not the trend. But I also recognize that we still have a long way to go, because the people that we're hiring that are brilliant, that can do all this stuff, probably are not going to relate to the data or the individuals or the solutions that we're trying to solve.
Yeah, that's a great question, because to most of us, data is data. There's no person, there's no visual, there's no name, there's nothing attached to it. So, we are not tied to that data, and rightfully so. You talked about two things that I want to touch upon, then I'll answer your question. There's inherent bias, we all know that. And, AI, we've been, as an industry, we've been talking about AI ethics. I don't think that we are, at least not in the US, I work globally, but we are not at a place where we have cohesively found answers to it. but we are hopefully going to get there, as you said. I think the second question is around when you know that there is bias in data, when you know that your algorithms actually inherently may have bias, right?
Mm-hmm.
One of the things that very recently, just last year, actually, one of the national foundations, I think it was NIH, actually put this $100 million research grant out. I was super excited about it because that whole grant was about how do you reduce and eliminate bias when you're using AI ML.
Mm.
And the way they did that was they had 4 different strands. And one of the strands, of course, was, what we do at NTT Data, which is using our technology, using our platform. We are agnostic of platforms. We have great partnerships and alliances with most everybody. We have Snow, we have Azure and AW, we have all of that.
Mm-hmm.
But I think the main thing there was that the partnership needed to be with a research institution. And the research institution, inherently, most research institutions have students, they have professors, they're being taught, and they were going to be the conduit by which they were going to learn how to reduce that bias, how to recognize where the bias was, and
Mm-hmm.
to how to reduce that bias. And now you're going to create not only a learning community, but frankly, a community of data scientists over time who are going to be very marketable in a potential workplace 3-4 years down the road, right? Depending
Mm-hmm.
on where they were what year they were in college. And the whole concept was fantastic. And I love that. So to your question around health equity or inequity is about, is the distribution of resources fair? And the answer to that is, of course, it's not. Is the disparity due to only clinical conditions, or is it also due to differences in your social and your environmental and in other factors?
Mm-hmm.
And this is the difference between disparity and equity. Disparity is frankly about what is the difference in my health status. When I'm thinking about health status, and is the difference too large? When I'm thinking about health status, to a large extent, we are always thinking about clinical conditions, right?
Mm-hmm.
Equity or inequity is actually more about, what are the conditions that prevail today? I could be living in neighborhood X, you could be living in neighborhood Y. We come from, say, different socioeconomic strata, and that has a bearing, frankly, on how I gain access to the types of care I should historically have access to, but I haven't historically had access to that, right?
Mm-hmm.
So is the distribution of resources fair is more about, so when you're talking about data scientists and using data, you want to begin with your assumptions and looking at data, and the types of data and the data sets are going to be different. Your health status data is going to be looking at primarily your clinical data, could be some other data too. But when you're talking about health equity, you're going to begin hopefully by looking at not only your clinical data, but actually all your social, economic, environmental data as well. Now, this is where data scientists can play a huge role. You talked about bias, we talked about AI ML, right?
Mm-hmm.
That's further up. Let's frankly first talk about our data sources.
Mm-hmm.
When it comes to clinical data, we may have some way of actually collecting all that data, either through our health clinics, through our health system, maybe through our health plan. There are some very concrete ways in which we have been collecting that. And we've been reporting it out as a nation because regulatorily, compliance-wise, a lot of accreditation bodies demand that, right? And then you have to validate that data. So I think to some extent, we've got that covered. Where we haven't covered this well yet is having a national repository on social determinants of health. Because my social determinants of health could come from my church, it could come from my nonprofit, it could come from my retail store, it could come from my Internet of Things, it could come from my wearables. So where is the integrity of the data and the quality of the data? Yes, I've collected data, right? You mentioned somewhere earlier at the onset of this conversation saying, hey, I actually found you first on LinkedIn and then through Wilda, and then we had a conversation. That's how we've gotten to know each other, right?
Mm-hmm.
But that's data. That's information that you pulled about Sue, and then something clicked, and then we talked, and then it just so happened that we were in certain, podiums together, and we had a conversation. That's how we got to know each other. Now that's data that we have collected, and then we hone in and say, okay, I want Sue to be part of this conversation. Now, but that is still one way, and albeit only one way of collecting your social determinants of health.
Mm-hmm.
We haven't, as a nation, talked about it. What are the standards that we want to come up? What is good quality data versus bad quality data? There are specific states who are doing excellent work in this field. The state of Oregon, the state of Michigan. So they are all either in the public health sector or somewhere in the Medicaid department, but they are collecting these disparate sources of data, putting them all together, having a social determinants of health framework, having stakeholder groups taking that data and then feeding it to different industries. It could be transportation. It could be to your Department of Transportation. That's another set of data. It could be your healthcare data. It could be data. So the key thing here is the utility of the data. The key thing here when it comes to health equity is once I know, let's just assume that we are working with the state of Oregon and they are a little further ahead and they've collected a way of actually collecting and standardizing, quote unquote, their social determinants of health. Let's just assume that they are there. They're not there yet, but they're definitely getting there. They're ahead of the game compared to some of the other states. Now, what are they going to do with that data? How are they going to address the issue of health inequity, right? This is where policymakers come in. This is where your legislators come in. Because if you are trying to then prioritize to say, here are the three things based on our new clinical model. Now I'm just going to go back to healthcare, not to transportation. But if you're just looking at a clinical model based on this, then here are the three priority zones. How did I come up with those three? I used my AI ML, machine learning. I did some predictive analytics around that, right? I can justify that because the first thing someone is going to ask is data good? Is your data source good? Is your data quality good? Do you have a standard that you have come up with? What is the framework? If you can answer yes to most of those things, if not all of those things, you're in good standing. And then you can go to your legislator bodies or whoever else, maybe your community leaders, and say, these are the three types of things we would like to provide a solution to, but with your help. Because relying solely on government never works. Relying solely on private sector never works. Relying solely on society to do things don't work. But sometimes if you bring those three pieces together, they sometimes may work. And so everybody has a role and a hat here. But at the end of the day, what you're providing as a data scientist is to give them that precise data that addresses the issue of health equity, knowing fully well that you're not going to be able to address not every aspect of health equity. So what aspects of it are you trying to address? And are you trying to do this by yourself? Or are you working with some of your key community leaders, maybe national leaders, maybe international leaders? Maybe you have a model that really works for you because it was done in Sweden and you see the exact same population here and in your community and it works there. I'm just making this up as I go. So again, the issue really is, are we asking the right sets of questions? Are we making the right sets of assumptions? Are we looking at the right sets of data? How good is my data? And then if those questions are answered, yes, then we apply that data. Because otherwise I see a lot of application, a lot of data modeling happening, but not necessarily helping my organization or my clients because frankly, they don't know what to do with that data. Yes, you've created that data model, but now the use of the data to drive the decision to have revenue impact is missing. I thought my estimates are going to be 30 million. I'm barely able to reach 3, right? So what good use is my data modeling if I'm not able to apply it in in my job, in what I'm trying to do as a C-level person, right? So you got to think about the whole gamut of how that is going to be applied. And there are people who want the big picture and the small picture. Those people happen to be like me. And there are people who say, I'm not interested in all of that. I was asked to do X, I'm doing X, and I did it well, I'm done with my job, right?
Yeah.
But to me, data has to be hopefully more than that. And as you said, I am passionate about health equity, and this has been something that I've been passionate about for many, many years, more than 27 years, because I've seen that health inequity everywhere that I have traveled, whether in the US or whether outside the US. All you need to do is observe. And I think as data people, we do a lot of observations. It's just innate, I think, in us. We constantly are observing.
Right.
Those are data points.
You've there's a lot of good takeaways in everything that you've discussed, a lot of key points and things that if I was listening to this, I could try tomorrow when I get back to my job. But as we look to wrap up, do you have anything else, specific lessons learned or anything, another woman who wants to follow in your footsteps? Any leave
So
behinds?
yeah, I think the leave behind for me would be don't follow in my footsteps. Create your own
Okay,
footsteps.
that's fair. I like that.
I, I think the main thing here is create, first of all, my key takeaways would be this. Reflect. Reflection is very important, and make that a continuous habit as much as possible. Every single day, take 10 minutes, just reflect. Reflect on your day, reflect on what was important to you and why that was important to you. The second thing I would say is start journaling stuff. Write down what you believe your vision is. Don't call it a vision if you don't have a vision, doesn't matter. Just start journaling. It'll take shape and it'll take form. And through that shape and form, write down your bucket list of the things that you would want to do and the things that you think you're good at doing, and then what you're going to do in order to hone in your skills. The reason I say hone in your skills, and I'm not talking about going and getting a certification, I'm talking about, learning through reading, learning through listening, learning through being an active participant in the workplace, learning through just being part of a webinar, whatever it is that floats your boat. There are many, many avenues for that. Learn from your mistakes. So one of the things that I will say is I have learned and acknowledged to myself the mistakes that I have made, say, in the workplace. So one mistake is, for example, I have not been very good. I'm a very creative person. There are ideas that are constantly coming and I'll throw out those ideas. And then I am also good in from creation to execution in terms of soup to nuts. And then, just share that with the rest of the world, only to find out that 5 other people actually took my idea and made something of it, right? So what I would say is be very open, but at the same time also create your own success. And part of creating your success, if you're a creator, if you're an innovator, there's no one on this planet that's going to stop you from the ideas that percolate in your mind, right? So that's just going to come because it's just innate in you. Start writing that down. And so now you've got your page that says, this is my vision. This is what here are the skills, here are my learning, this is what I need to do. And then you have this other page that writes, you have all your ideas down. And then some ideas are you can just throw them away because you know that it's just an idea, it's not going to come to fruition. The others you can test. And the 1 or 2 that actually come to fruition, learn, start jotting down, at least mentally, if not physically, what tweaks you had to make, what time did you invest. And in that learning, you will find that there are certain things that you're extremely good at. Whatever you're really good at, start honing in on that. What you're not good at, but you still have a passion for it, try and formalize it, learn through your peers, maybe get a certificate here or 2. What you thought you were good at, but you find that you have no passion around it, you figured that, no, that really isn't my cup of tea. Keep that in the back burner. Maybe that's what you do when you eventually, quote unquote, retire, because you may still have a little bit of a passion, but that's not your forte, right? So understand your limitations. So my key, the last things I would say is be true to yourself. I typically don't like to follow anyone's footsteps per se, but I watch their footsteps.
Mm-hmm.
I watch very carefully because, I'm a leader, more of a leader than a follower, and there's nothing right or wrong in that. And I think the third thing is, at the end of the day, you really have to ask yourself, what are the 2 or 3 things that I think I have contributed towards? It
Mm-hmm.
may be a drop in the ocean. It does not matter. But you feel good about it. You say, yep, I was passionate about it. I gave my time, my effort, and I created these models, right? For
Mm-hmm.
me, it's health equity. For me, it is education. It's a number of different areas, not just around health. But for me, it's many different things that I know, but I've honed in and I've said, okay, I have 2 or 3 things that I know I am going to contribute towards, and I've made an effort to contribute towards that. Whether I'm a leader in that or not, it doesn't matter.
Mm-hmm.
And I think this is where you start using data for yourself, because you are now being reflective of how you want to invest your time and effort, where
Mm-hmm.
you're going to invest that time. And the way you go about doing it is by actually going back to your journals, if you've journaled it, or to your mental map, and look at the data points. What does your data point tell you?
Mm-hmm.
What really excites you? And how consistent can you be? Because while you may think you've put in 100 hours and you should get your results, you may not get those results. You may get those results 5 years down the road. So patience is very important. And that is one thing that my PhD program taught me. It is not so much just about intellect. Frankly, it's about teaching you to be very, very, very patient, because the results that you expect today are not the results that you're going to get. So I'm very thankful to my professors and for my teachers, because by nature, I am not that patient. And so I have learned to pace myself about being patient. And just because the data tells you something, please don't jump and say, so this is a solution.
Right.
Think about what that solution
Yeah.
would be long term.
Those are all brilliant. Thank you. Thank you again so much for your taking time out of your day. This was great. We appreciate it.
Well, thank you. I don't know whether I made any sense or not, but no idea. I
All
don't know
right.
whether I even answered your questions, frankly.
You're wonderful. Thanks a lot.
Thanks.